Somebody can be eligible for hospice. That doesn't mean that they're ready for hospice. We look at if they have a terminal diagnosis, and we also look at whether somebody has about 6 months left to live. That's not always the case, but those are two qualifying factors that we look at to determine if somebody is eligible for hospice. We look at a decline in their functional status, so maybe their ability to walk or their verbalization. We also look a lot at weight loss, falls, infection, that kind of thing.
It was overwhelming before hospice came here. Every day was getting harder and harder, not only physically but mentally for me and Mom. It was getting harder for me to lift her. It was getting harder for me to change her.
Being a caregiver is difficult at times. There's a lot of decisions you're making. There's a lot of kind of plates spinning at one time.
We talked about it, me and Rick, of, when we were gonna go to Mom's visit, we were gonna ask about, what is a good time to go on hospice.
It can be both from a provider perspective or a patient perspective about being ready for hospice. There are people who get referred who don't understand hospice, and so I think it's a lot of education about what hospice has to offer. Also, what the goals of the patient are. Do they want to go back to the hospital? Do they want to seek aggressive medical care? There may be a time where, a patient decides that they no longer want to be in the hospital frequently. They'd rather be at home and surrounded by their loved ones in their own environment.